Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is what are the indications for spinal discectomy surgery for sciatica? Sciatica occurs in about 1 to 2% of the population at any given point in time. Most people really have no idea what they did to spark it up. Typically, though, it's due to a slow disc degeneration over years that eventually results in a tear of the outer part of the disc and the inner part squeezes out, such as you see here. And when it squeezes out, it can often pinch on a nerve root, and that's what can lead to sciatica. So when you have that, it can lead to numerous types of symptoms. It could just be leg pain, a burning sensation, pins and needles sensation, possibly some numbness, maybe some muscle weakness, and then rarely you can get some incontinence. So initial treatment should consist of a short period of bed rest. Used to be a week was thought to be normal. Now we know that anything longer than 2 days is actually worse for you. Over-the-counter medications, anti-inflammatories, and Tylenol. Physical therapy, chiropractic, spinal decompression therapy have all been shown to be of benefit, even acupuncture. Prescription medications may include Medrol dose pack, which is a short burst of prednisone with a taper. That helps tremendously. You shouldn't do that more than once every few months, though. Narcotics, short-term, muscle relaxers, and neuropathic medications can help. And then we have the interventional treatment, such as you see here, trigger point injections, and then this is an epidural injection where the steroid is placed right around the area of pinching and can provide excellent pain relief. So what are the indications? There's 3 types of indications for sciatica surgery. 1 is absolute, means you got to have it. 2 is relative, means it should be considered, but it's not absolutely necessary. And then quality of life procedure. So starting first with the absolute. The condition is called cauda equina syndrome. Okay, so the spinal cord itself ends between L1, T12, L2, somewhere around in here. All right. After that, it really is just a bunch of filaments. Okay, called the cauda equina, and what can happen is a large disc herniation can push on this area. It can cause irreversible incontinence of bowel and or bladder and trouble walking. So it needs to be treated within 24 hours. That's the rule. And if it is, then you can possibly avoid any permanent problems with bowel and bladder incontinence. Now, relative indication for surgery is something such as motor weakness. So if you have trouble, for instance, lifting up your foot, that could be due to an L5 nerve root compression. And it can be watched to a point. So if it's getting worse, that becomes more of an indication for surgery. But if it's stable and then starting to get better, you can sort of watch it. The question is, how long is it okay to watch it? Some people say 6 weeks, some people say 3 months, but it's going to vary from person to person. The key is you don't want to watch it too long, because let's say you watch it for 6 months, and you go in and do a technically perfect surgery, and it may never get better. So that's the big question. What's too long? Now, elective is sort of a quality of life decision. If you've had 6 weeks or so of conservative treatment consisting of, all the things we mentioned, medications, PT, chiro, decompression, injections, and nothing is working, then consideration can be given to surgery. Studies have shown, actually we'll look at this in a second, studies have shown that less than 10% of people end up actually needing surgery for sciatica. Over 90% good to excellent results if you do have surgery. There was a landmark study years ago. Those who were in the elective type of category, if you can wait, the outcomes are at 1 year are absolutely identical. The ones who did opt for surgery ended up having pain relief faster and got back to work faster, but the outcomes at the end were no different. And without surgery, obviously, you avoid those potential risks involved. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the Mid-Atlantic region, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.